Hey there, listeners. Welcome back to Let's Get Oral. Today, we continue our IDM Totality of Care series on Airway Health by sharing our conversation with Dr. Bill Hang, the founder of the Ortho to Health community. Dr. Hang has committed his career to advancing a paradigm shift of thinking in orthodontics that rejects traditional, retractive techniques in patients of all ages. This commitment is largely focused on proactively addressing airway health challenges and emphasizing the critical role of dental professionals in this mission. With that out of the way, let's jump into this engaging conversation with Dr. Bill Hang.
Let's get oral. Let's get oral. We're here at the IDM Conference of Totality of Care with Dr. William Hang, who is a centerpiece, actually, of this conference. Very well regarded. He's been in orthodontics for over 50 years, although it sounds like you're wrapping it up.
I am semi-retired. Yeah, I don't see patients anymore, but I had 50 and a half years or so of clinical practice.
And you still have a couple mentorships going,
Right.
So we can all train with you.
I have two mentorships. One is called ECHO, Early Childhood Health-Centered Orthodontics, where we're focusing on trying to teach people to treat for medical reasons prior to age 6, before any child even gets their first permanent tooth in. Focusing anything under age 10 in that. And we're doing the exact opposite of traditional orthodontics, which is retractive. We are trying to develop the face forward as we were meant to grow forward like our ancestors so that our faces look better and our airways are better. That's one mentorship. The other one is the ERRS mentorship, which is extraction, retraction, regret syndrome. ERRS meaning mistake. A purposeful acronym that my wife and I came up with, and people laugh about it. It's deadly serious. We define it as a constellation of aesthetic, functional, and emotional signs and symptoms brought on by orthodontic retraction, all of which are preventable. And once I put this out there, did some video on it and wrote some articles, and I started getting people from all over the world contacting me, identifying as a, quote, poster child for ERRS. So it is a very real syndrome.
I did hear that you were once controversial in the field. What brought you to kind of raise the roof?
Well, you know what? I am not the rabble-rouser at all. I was the goody two-shoes boy. My dad taught engineering at the University of Illinois. My mom was a very straight-laced, very common-sense person, not an emotional person at all. But more than anything, I was an Eagle Scout. And I if you know what that means you're a kind of a fuddy-duddy. I've never been offered drugs by anybody, nor my wife. I'm very straight-laced, and I went to dental school. I happened to graduate at the top of my class of 92 people because I knew how to be a good student, and I had great hands. God gave me good eye-hand coordination. But so I didn't, in dental school, like all dentists, I didn't ask anything other than how. I'm going to go do something. I'm going to go dentistry. How do I do it? Never ask why. If I could say one thing to those students out there, and I'm going to tomorrow, ask why. If you start asking why, most of the faculty is probably not going to like you because they don't want to have to defend what they're doing because they were taught to do the same thing that everyone else was taught to do, which is why we're no farther down the road than we are right now. If everyone were asking why, then we would have to defend what we're doing. There's an article in one of the dental journals talking about the fact that about 8% of what we do in dentistry is evidence-based. And yet, go on websites all over the United States, you'll go to a person's website. Oh, I have an evidence-based practice. Really? No one has an evidence-based practice. So that kind of thing made me rather controversial. I stopped taking out teeth Many years ago, I took out teeth more than 50% of the time as I was trained to. But when I began looking at faces after a few years of practice, I realized those faces weren't looking okay. That's long before I knew a thing about airway, tongue space, and how retraction could decrease the airway and the tongue space. Before I knew about sleep apnea. Well, back in those days, the term sleep apnea hadn't even been coined yet.
So for the average person, what does retraction mean?
Retraction means bringing the teeth back in the face by one technique or another. The sad part is most traditional orthodontic treatment is retractive, whether teeth are taken out or not. The face ends up being further back. You use rubber bands from the upper teeth to the lower teeth to bring them together. That retracts the upper front teeth. You use a headgear to retard the forward growth of the upper jaw in what we call a Class 2 patient. Now, the funny thing is, since July of 1981, the refereed literature has said that the maxilla does not protrude. We've known that since 1981. And people are still being taught to retract and stop the forward growth of the upper jaw. In reality, the upper jaw in Class 2 patients is usually 8 to 10 millimeters too far back. Too far back. So to really treat that person to get the best looking face, you need to develop the upper jaw forward and the lower jaw forward. The traditional orthodontic community has no way to do that. And so that's a good way, when you say the truth, to get your name to be not so good. And that's how I got to be controversial. That and I've written articles and I've been outspoken. But I do it because I'm an Eagle Scout, because I'm a straight-laced little boy from Urbana, Illinois that learned right and wrong, wanted to make my mom, my dad, my grandparents happy, my Little League coach, my minister at church, my Boy Scout leader. I'm a guy there to please. And the only way I could really do that is to stand up for what's right.
So I love that you were looking at the whole face to notice that the faces weren't looking quite right. What was the distinguishing feature for you? What really stood out?
There's so many things that you can talk about. You can draw a line from the nose to the chin, and you can see that the lips are back from that line, and the face is sunken in. And that's easy. You can see that the cheeks are flatter than they were in the beginning. You can see that the chin is further back than it was. You can see that the smile is narrower. There's so many things that are easy to look at that way. You can see many people have forward head posture. They hold their head forward, they tip their head back. It keeps their chin forward. Because, and I've seen this out of the refereed literature, I can show you how by retracting you can stop forward growth of the entire lower jaw from the refereed literature. Now, I look at the article in a different way than the guy who wrote the article. I look for this kind of thing, but the people who are writing it think they're doing something good for somebody. But I can show how retractions basically can stop the growth of the lower face. Once you start to look at it, you see it's everywhere. I mean, out in this room this morning, I looked over the crowd, and I thought, just like I do in any crowd, there are a lot of people who've been retracted here, and a lot of them are suffering, and they don't know it, which is the sad part. Once you really see it, it's easy to see. That's why my two boys, they're 48 and 46, never considered dentistry at all, because we'd get on an airplane and go somewhere, and the flight attendant would walk down, and I'd say, look at her face. She's had teeth taken out. Her face is all caved in. And they just feel like, oh, my God, I have to have this guy as my father. So when they decided what to do with their lives, dentistry wasn't on that radar screen for them. Let's just put it that way.
No passing the business on, huh? Well, I know you have a lot of followers, so I'm...
Yeah.
A different type of passing the torch, I think, is happening with you.
I've been blessed. I have had, and I've run into some of the most wonderful people in my life. I've had a number of really good mentors myself. And honestly, we live in a crazy world right now. And if we can't do something to make that world better and thank the people who've mentored us, that we stand on their shoulders, we need to make it so that the next generation is motivated to have somebody look back at what I'm doing or what I was doing in my career and laugh about it and say, oh, my God, was he antiquated or what? And that would be a good thing. But unless you ask the why question, you're never going to get past what's always been done.
It's true.
That's fantastic. Since we're at a dental school, right,
yes,
where it's this essential junction between wisdom and youth and passing things forward when it comes to experience. And I appreciate that you really highlight the importance of asking why.
Right.
Do you have any advice for these promising students to consider if mentorship were to become part of their offering?
I would have a lot of advice. Number one, ask questions all the time. And I didn't. I sat in the back of the room, and I was a great student. I graduated number one in my class. I knew how to take tests. But if I were to do it over again, I would say, I want to know why. And that's what they need to do. And ask the question in a nice way. That would be the biggest thing. But also, what's happening, and it's sad to see, that so many students are, coming out of school with a mountain load of debt. It's awful. My dad was a college professor, didn't earn a lot of money, but he wrote all the checks for me to have a dental education, and I came out of school debt-free. Didn't cost in 1966 through 70 what it costs today, but it was a great gift to me. Now, the people coming out today have got a mountain load of debt, and they have to stay true to what they have to do, but they also have to make a living, and that's the sad part for them. And so to the degree they're able to find someone who has a private practice, and I'm a huge fan of private practice. I think that the quality is going to be in the private practice, not in the corporate practice. I don't want to be in the Walmart of dentistry, and not that there's a thing wrong with Walmart. I don't want to be in that at all. I want to be where I can do what I know is right for you, and you decide that it's right for you, and you pay me a fee, and I accept it gladly, and you gladly pay me that fee because you perceive the value. And so I would hope to have, that each of these students could have mentors that are like that can help them understand that they can be in charge of their own future, and not just be in corporate dentistry and, I arrived today, I got to get on the treadmill and start cranking this stuff out. And by the end of the day, I have to have done so many crowns and so many endos and whatever. And this is really completely unethical. But let's be honest, that's what's happened in dentistry.
So I was raised in my PhD program in a dental school where I did dental research, mostly in oral pathogens and immune landscape. But one of the things I noticed is with pediatric dentistry, there were many, both professors and students, who really didn't know what to do with a 3-year-old. So what do you do with a 3-year-old that helps you identify an issue that early on?
In a 3-year-old, the history will tell you what needs to be done in most cases. Many of the 3-year-olds that need treatment may have had premature birth. Many were not breastfed. Breastfeeding is the way it should be. Many, their mother didn't do the right things during pregnancy, and so the child is born paddling upstream. They can't breathe. And you learn this. The child is making noise. Breathing should be completely silent. There should never. So if you ask the parent, gee, do you hear him breathe? Oh, he snores. Oh, snoring's not okay. Snoring's never okay. Snoring is one thing. A lot of upper respiratory infections. They've gone and, oh my gosh, I had to go see the ENT and have to have tubes put in the ears. Oh, had to have tonsils and adenoids taken. These are all things that relate to that. The kid is he a restless sleeper? Oh, his bed is torn up in the morning. Like a tornado came through last night. That child is not sleeping well. Those are very obvious things. Easy to see, what we call an accentuated Cupid's bow, where the upper lip goes up. Flaccid lower lip like this. Dark circles under the eyes. And even at that age, you can start to see the face is beginning to lengthen and fall back. Once you understand what to look for, it's totally easy. So the history tells you right away, and then you go and you do the oral examination, and there's a very simple test to do. You measure from the tip of the nose to the edge of the upper front tooth. And in a male, that number should be 3. The patient's age in years, 3, plus 23, should be 26. That number will be over 30, to mid-30s for a 3-year-old because the face has already begun to fall back. Now, in the traditional orthodontic world, we sit back and we don't do a thing until all the teeth are in,
Right.
at which point that's the difference between smelling smoke and having flames go through the roof of your
Yes.
house, literally. And that analogy has not won me a lot of friends, but it's a very true analogy. So age 3 is ideal. Now, do I really enjoy treating 3-year-olds? In reality, yes, I do. I just, but in reality, I'm selecting the mother. The mother is going to be in charge.
Yeah.
She's going to be my agent. She's motivated. She'll do anything. She's going to move mountains so that child's going to have something different than she had when she had retractive orthodontics. And so all we have to do is have the parent educated, and treatment becomes really easy and gratifying and absolutely more fun. If I never put braces on a 13-year-old kid again, it would be just fine. 13-year-old kids typically hate you, hate their parents, they hate themselves, they hate their teachers, they hate the world, and they don't smile. And they become people again, hopefully, in their early 20s after college. They join the world again. But I'd rather treat a 3-year-old, 4-year-old any day. And I maintain that instead of the traditional time of orthodontics being 12 or 13 when all the teeth are in, I call that rearranging the deck chairs on the Titanic. The face is already so far down and back that no matter what you do, many of these people are not going to have a good future. They're not going to live a normal life. Their airway is already compromised so much that they're struggling. Right then, the best they can have is straight teeth and a face that's too far back. If I treat really young, I can optimize the forward growth of the face. If I can get them to have their lips together, breathe through their nose, they're going to have a great life. I say we need to complete our orthodontics. What a world would it be if we completed the orthodontic treatment before the first permanent tooth ever came in at age 6 or 7?
That would be incredible. Do you think there are many dental schools with this type of programming?
There are, to my knowledge, there are 0 dental schools doing this. The interesting thing, and I'll show this in my lecture on Saturday, the interesting thing is this was being done over 100 years ago.
Can you say that again?
This was being done over 100 years ago. And you say, you're kidding. Well, how did we get away from it? Well, that's an interesting story.
Yeah.
Well beyond this interview. I can go on and I could tell you that whole story and tell you how I know it happened. But it's not really relevant. The fact is, the American Association of Orthodontists used to have a brochure, age 2, age 7. See the general dentist at age 2, see the orthodontist at age 7. Age 7, for many kids, they're not ever going to read. They have brain damage. My good friend Phil Cooper from Savannah, Georgia, an African-American dentist, has written a book called Why African-American Kids Can't Read. Has nothing to do with their skin color. Has everything to do with the fact many of them come from a background where they've had breathing issues. Their diets are not the same. They're not as good. They're having this and that. They're struggling, and they have apneic events at night, which causes brain cells to die. And so whether their color of skin is purple, green, orange, it doesn't matter. They have issues. And any child, I'll be presenting data on that. Ron Harper from UCLA is a neurobiologist, researcher, and he's done research with MRIs of brain and showing the areas of the brain that are damaged with just one night of reduced oxygen saturation. The interesting thing is this was listed back in the early 1900s talking about mental retardation. Now, they didn't have fancy terms back in those days,
Sure.
but this has been known. And dentists were treating specifically to try to get kids to be nasal breathers back then and avoid brain damage. Charles Dickens back in the 1800s described this and how delinquency was happening and how if we could only get kids to be nasal breathers really early on. It's not new. We just have different terms for it.
Wild.
It's crazy.
So you're reinventing this very old wheel.
We're just trying to get back to where we used to be, and do it in a more modern way. But the trouble is, we're dealing with a completely different world than 100 years ago.
Yeah.
Were you able to go down the aisle in the grocery store and get the little packet of yogurt that's in a package like this, and you rip it off and you suck it out? No.
No.
You don't even have to chew, and that's why our faces are back. You don't even have to chew. George Catlin was a Philadelphia lawyer in the 1830s, later became an artist and went to live amongst the Native Americans in the West. And he was a photographer and an artist, and he wrote a book called Shut Your Mouth and Save Your Life. What a great title for a book. And it isn't what you think. I've thought of that a lot. There are some people I'd have liked to seen them shut their mouths and save their life. But it really has to do with, he recognized back then the Native American women would breastfeed the child. As soon as they came off the nipple, she would take her fingers and put the lips together like that, make sure that the lips were together. And he drew pictures in this book of the Caucasians back on the East Coast sleeping like that with their mouth hanging wide open. And then here's a little papoose, little Native American child, which he, by the way, called savages.
Of course.
Before we had political correctness. Here's the Native American child sitting there out in the open, lips together, and they end up with a better looking face, and they're healthier. Now, in my life, what do I look at? I run the Boston Marathon. Who wins the Boston Marathon? 100% people from Ethiopia or Kenya. Now, go look at them. They have broad smiles, huge broad smiles, cheeks that are forward like this, their face that is forward like this. They're cheating. They haven't. we haven't messed them up with civilization and got their faces back. If we could just get their faces back, they probably couldn't run any better than we can.
Oh my gosh!
But they haven't eaten. They haven't been civilized to eat the garbage that we eat. I don't mean it that way.
No, but
they're
really,
civilized, but they're not industrialized, for God's sakes.
Yeah.
I joke around and say, someday I'm going to take my cone beam X-ray machine and set it there on Boylston Street in Boston, just past the finish line of the Boston Marathon. And when the winners and all those top 10 finishers come in, we sit them down in that machine, take pictures of their face with cone beam X-ray, and look at their airways. And then I'm just going to sit there and say, if I had an airway like that, I could run that way too, which of course is an excuse, and I know it's not true, but you know, it's a nice thought.
An element of truth, probably.
Shave some seconds off.
So, do you see any change coming for our dental education that might give us hope?
I am thrilled to be here because of this session, and I must admit, I was skeptical, but this morning made me feel phenomenal because the speakers were great, and I think it has to start somewhere. I could give you all kinds of examples, which I won't, about the resistance to change. But in reality, it's no different in dental school or medical school than in our society.
That's true.
People want to hang on to what they've always been doing, and they resist like crazy. Galileo was way ahead of his time, and you know they wanted to kill him, and yet. Yeah, and there are lots of different examples of that throughout history. But I, to be honest with you, I don't think we have a choice here. A good friend of mine is a myofunctional therapist. Her name is Joy Moeller in Southern California. Probably 10 or 15 years ago, she says, "I don't know that we're going to survive as a society based on what we see happening." And I thought, you know what? And I said it to her, Joy, you're an alarmist. I don't think you're right. But as the years have gone by, I begin to wonder if that's not the case. And I'm serious when I say that. There are so many different factors out there. If you look at the breathing issue, if you look at what we're eating, if you read a book by Metabolical by I just heard him speak on a pediatric endocrinologist from San Francisco.
Metabolical? Is that
Metabolical, yeah.
That's great.
I mean, what we're eating is horrible stuff, okay? And that's all bad for us. Then you read another one, which is called the Invisible Rainbow by a physicist, talks about all the electrical fields we've got going on. Then if you read any of the books about breathing, and there are many more of those, Breath or Patrick McCune's books, Oxygen Advantage or The Breathing Cure, I mean, you begin to think, this is a big deal. I mean, the Metabolical talks about non-alcoholic fatty liver disease. Yeah. Is it crazy we have 15-year-old people getting liver transplants?
That is crazy.
How can we afford that?
We can't afford that.
We can't afford that. And how long is that liver transplant going to last? Anyway,
right.
Is a 15-year-old going to be around at age 95?
No.
I doubt that, seriously. Mm-hmm. So as a society, we're putting all this money down a rat hole. It never buys any health. You can't buy health. The only way to have health is if you are in charge of your own health. And yet, does my insurance cover that?
Am I in a food desert?
Right.
There's a lot of questions.
Tell me the pill that I need.
Right.
I mean, my wife and I watch the History Channel, and it's just like one drug after another that comes out here. And the diabetic woman who weighs 50 pounds over her weight is going to tell me about Jardiance, and she's dancing in front of the camera and what a good life I have because of Jardiance. And I thought, really? And there's hope for the world? I don't know. We have to stop somewhere. We have to make it. When we have a dental school that is focused on health, not disease, and not on treating the symptom, right, but on treating a cause and getting people to be healthy, to optimize their health span, so that hopefully their health span and their lifespan coincide.
Yes.
That would be good.
Yes.
How many people sit in a nursing home? I'm going to use a video tomorrow or on Saturday that talks about what happens when a mouth-breathing kid grows up, and it's about 15 minutes long. It's a video we use. And everything goes along down the road, and this kid has orthodontics done. He's mouth breather. He snores. His mom thinks that's cute. It's not cute. He goes to the orthodontist, has primary teeth taken out. That only makes the crowding worse. Then permanent teeth are taken out. He's retracted. The face falls back. The chin doesn't exist. He gets married. His wife, in their wedding pictures, tries to get the pictures taken so it doesn't show the fact that he has no chin. One thing goes to another, to another, to another, and then finally he has his first heart attack, and he's near help and is saved. But then and then someone suggests, you may have sleep apnea. So he gets a sleep test. He has sleep apnea. He's given a CPAP machine, which he doesn't use, which wouldn't do him any good anyway. And I was happy when Gina said that this morning, by the way. And then he has a stroke. And he goes to a nursing home, and he vegetates in that nursing home for 10 years before he starves himself to death. Mm-hmm. Now, this is something that my wife and I made up, but it's not made up. The final bit was my Uncle Ralph. From my Uncle Ralph McGoy from Russellville, Indiana, was a funeral director. My grandfather was a funeral director, his brother. But Uncle Ralph had a stroke. And Uncle Ralph was skin and bones. He was a skinny guy. He was not overweight, but he had flat cheeks. What do I know now? I know my skinny Uncle Ralph would have had sleep apnea. And that he had that stroke, sat in a nursing home for 10 years vegetating, not able to speak to another human being for 10 years until he decided this isn't worth it, and he quit eating. And that's how my video ends. Oof. And that's just what's going on in nursing homes all over.
Yeah.
Everywhere.
Yeah.
We can't afford it.
I do like that I'm seeing this trend of wellness and longevity, people really wanting to take those healthy steps. I think that, a lot of our society is still grappling with the expense of some of these programs. So I think that we still have a lot of hurdles, but I like that there's a focus there.
The only way is to prevent. I mean, when you talk about expense, prevention is cheap.
It's true. If we can just change the perspective there, I agree with you.
And everyone's in charge.
Yeah.
And, but we're all looking for, the pill. Look at the whole Ozempic thing right now. Oh my God.
Everywhere.
Oh my
it's
God.
Everywhere.
I don't even want to hear about it.
I'm sure there'll be research about how it helps your mouth at some point.
I'm happy to see this institution take that step, and I'd be thrilled to be part of it any way I can help them do this. I'm happy to. We owe it to the next generation to do better, and the only way to make it any better is to stop the craziness that's going on right now.
Yeah, I agree. I think that's a great place to end. Thank you for sitting down with us.
No problem. Yeah. Thank you. So nice to talk about.
Yeah, you too.
Thank you.